shoulders, knees and toes. Knees and toes. Head, shoulders, knees and toes. Knees and toes. Eyes and ears and mouth and nose. Head, shoulders, knees and toes.
Right, here we are again. So what I'm going to do now is go through with you very quickly examples of how the Amino Neuro frequency process works alongside the discs and the palpitation assessment. So what we've got here is from the manual. So we've got basically the pattern of how we may apply the discs when someone's got an issue with the hip. So this is just like a general therapist guideline, but what we'd have to do is find out exactly where these marks on your own body may or may not be. So we've got a front side, rear side of the body. So in this particular example, we've got the negative frequencies, 1, 2, 3, going down the hip, because that's potentially where the main pain points in terms of the root cause may be. And then on the rear side, obviously these are being applied to the bare skin. We have 1, 2, 3 of the positive pain and inflammation discs. Then here at the sacrum, we've got a medical calm, and then at C7, another medical calm. So these would be the areas of examination. Now, had some success with this in the past with a gentleman who I believed it was a lower back pain issue, but we tried this instead for the hip, and hey presto, his lower back pain went away as well and has not returned. So another example we have here is the TFL, the tensor fasciae latae muscle. So whereas on the hip one, it was more towards the midline of the body, this is more on the outer edge. So in some cases, what we try to do using the palpitation is to make sure that this is why we don't chase pain. So we do our assessment to make sure that it is actually, is it the hip, is it the lower back, or is it the TFL? Because obviously these two they're in close proximity. So that's that one. Another example I've got here is, so there are two examples of how we'd actually deal with the shoulder issue. So the one in red looks at a pattern where there's positives and negatives towards the front of the body, and then on the rear we've got another negative, and then we've got our old friend the medical calm going in at C7, and on the other example we've got the medical calm going in at C7, and more of a pattern that sees positive and negative pain and inflammation going across the rear end of the body and then towards the front of the body, with another pain and inflammation at the end of the acromion. As I say, so these are only rough guidance. I've had a lot of success with this one with people that have had frozen shoulder, they've had multiple dislocations, they've had rotor cuff issues, and I've gone in and none of them have been exactly like this, but all of them have been successful. Moving on. Oh, yeah. So when people have had issues which we'd believe that it may have been very much within the neck, it's turned out to be the supraspinatus. So we've used this smaller protocol. I've actually used this protocol with people who have had neck complaints, and on an original assessment of palpitation, this is the treatment plan that we actually went for. And then with the follow-up one, based on some information that we got from a MRI scan, we managed to actually find out that the root cause was actually lower down into the body. So what we decided to do is go for a totally different approach, where the discs were supporting, but you had them using my intercellular cleanse and level 3. So moving on from there, we've got a smaller example. So this one's someone who's got like wrist pain. So we've got, on this example, we've got pain and inflammation on the inside edge of the wrist, or we've got a negative on the inside edge and a positive on the outside edge. We always start with the lowest frequency number, and then we've got a medical calm up at C7. So that's one that we can use commonly for the wrist to avoid carpal tunnel surgery. This is a more involved protocol that we use for, actually use this for a number of different things. That people with like a number of, I've like stomach complaints, pelvic area issues, gynecological issues, cysts, ulcers, number of things that this is actually brought about a lot of success in managing a lot of people's pain. So it's like a large spread of pain and inflammation negatives at the top. Then we've got round at the edge of the inside of the pelvis, pain and inflammation positives, medical calm below the navel, and carnosine underneath the solar plex. So moving on to one that's quite common, which is knee pain and arthritic knee pain. So this is one of the more involved protocols that we'd use, and we used the one that you can see in red here quite recently with someone who had an arthritic flare-up following their vaccination. So this pattern that we had here, we had to actually go lower. Turns out that I think the spike protein had triggered something off inflammation wise. So again, this just ended up being a supporting factor, and they then went on to the intercellular cleanse level 3, the clear body solution, and that managed to sort things out inside of 2 days. Obviously with that situation, the work's ongoing. So that's an example of how these things are incorporated into the work that we do at Release and Balance Kinetic Therapy Clinic. This is Coach Tee Cee out. Bye for now.